Hello everyone. Today we are going to study uh, mediastinum. Mediastinum is one of the anatomical topic which frequent comes in the examination. First we will start the mediastinum on the definition of mediastinum. Okay, 1 minute. Okay, what is mediastinum? Mediastinum is the thick mass tissue. Okay, which is a thick mass tissue occupying the median part of the thoracic cavity. Thoracic cavity forming a median septum between the two pleural cavities. The two pleural cavity in between the two pleural cavities, the part is mainly known as the mediastinum. In between the two pleural cavity part of the pleura is the covering of the lung. So pleural cavities are there. In between the two pleura, the space is which occupies the median part of the thoracic cavity, which is a thick mass of tissue occupying the median part of the thoracic cavity, forming a medium septum within the two pleural cavities, extending from the sternum anteriorly to the vertebral column posteriorly. Okay, now come to the diagrammatic picture. You have to draw the diagrammatic picture in the exam. Okay, the sternum here, this is the sternum. This is the sternum anteriorly, and this is the vertebral column posteriorly. So in between the two pleural cavities, this space is known as the mediastinum. Okay, now come the structure. What are the structures are in the mediastinum? It includes a large number of thoracic structure, that is mainly the heart and the large vessels of thorax. Okay, first structure is the heart and the large vessels of thorax. Next one is the tubes entering the thorax. What are the tubes entering from the thorax? From mouth it is the trachea and the esophagus. Okay, and number third one is the nerves, lymph nodes and the lymph vessels of thorax. Okay, these are the structures which are in the mediastinum. Then comes to the boundary. What are the boundaries of mediastinum? Anteriorly is the sternum. This is the anterior part. It is the sternum. The sternum is further divided into three parts: manubrium sterni, body of the sterni, and G5 process. Here are the junction point. Okay, this one is the manubrium sterni, body of the sterni, and this one is the G5 process. Okay, the anteriorly it is sternum, posteriorly is the vertebral column. Okay, posteriorly in the vertebral column, superiorly the plane of the thoracic inlet. Superiorly, this is the, if you can't mainly the thoracic, you can say the thoracic inlet. Here is the thoracic inlet. Okay, and inferiorly the diaphragm. Here the inferiorly diaphragm. On each side the lung and the mediastinal pleura. Each side, both sides from the lateral. Here is one lung and another side is another lung. Each side is the lung and the mediastinal pleura. Okay, so these are the boundaries of the mediastinum. Okay, next comes the division of mediastinum. The mediastinum is divided by imaginary plane extending from the sternal angle anteriorly to the lower border of the T4 vertebra posteriorly into two parts. One imaginary line which divides the mediastinum into two parts. So now you will see the imaginary line. What is the imaginary line? The imaginary line is this one, which comes from the sternal angle. Okay. What is sternal angle? I will see what is sternal angle. This sternal angle is the junction point of the manubrium sternum. This is manubrium sternum, and this is the body of the sternum. It is junction is here. This is known as the sternal angle. So the imaginary line draws from anteriorly from the sternal angle towards the posteriorly imaginary line to the lower border of the T4 vertebra. Okay, which further divides into the two parts. Okay, further divides it into the two parts. One is superior mediastinum, one is inferior mediastinum. This one is superior mediastinum, and this one is inferior mediastinum. Okay. So next one is the further the inferior mediastinum. Further, the inferior mediastinum is subdivided into three parts. One is anterior mediastinum, middle mediastinum, and posterior mediastinum. Okay. So there are total four subdivisions. One is mainly two subdivision. Another in inferior mediastinum, which is further subdivided into to three mediastinum, but that is anterior, middle, and posterior mediastinum. Okay. The first subdivision of the mediastinum was superior mediastinum. Here comes first place the superior mediastinum. So superior mediastinum boundaries are anteriorly is the manubrium sternum. You can see the manubrium superior mediastinum. Anteriorly is the manubrium sternum. See here. Anteriorly is the this one is the manubrium sternum. This one manubrium sternum. And next is the posteriorly the upper fourth thoracic vertebra. Okay, upper four thoracic vertebra. T1, T2, T3, T4. Fourth thoracic vertebra comes posteriorly. Okay. Next is the superiorly, the plane of the thoracic inlet. That is mainly you can once say thoracic inlet, and this one is thoracic inlet. This is the thoracic inlet. This is thoracic inlet. Next one is the inferiorly, an imaginary plane passing through the sternal angle in front and the lower border of the T4 vertebra behind. That imaginary line, I say, which divides the superior mediastinum from the inferior mediastinum, that is anteriorly the sternal angle and posteriorly the lower border of the T4 vertebra behind it. On each side, it is the mediastinal pleura. Okay. Now, anatomical content of the superior mediastinum. What is the anatomical content? Mainly, there are the four division, mainly four, and you can say five division. Number one is the prevertebral layer, which contains anterior longitudinal ligament, two longus colli muscle, and three prevertebral fascia. These are the next one is the tubal layer, which contains mainly the esophagus and the trachea. The tubal layer which contains mainly the esophagus and trachea. Okay. And the arterial layer. Arterial layer mainly is the arch of aorta. That is the arch of aorta. Okay, mainly. And beside the arch of aorta, there also comes the left bronchus, the ligamentum arteriosum, and the recurrent laryngeal node, and the superior cardiac plexus. You have to know these names only because it's not often comes in the exam, the details. You have to write the names only, what are the structure, anatomical structures are there in the superior mediastinum. Okay. And next one is the venous layers. Venous layers contains two veins and upper one third of the superior vena cava. This is superior vena cava. The right innominate vein, the left innominate vein, and the upper one third of the superior vena cava. These are the contents, venous contents. Okay, you can write notes about it in your copy. Okay, and the last is the retrosternal layer, which has the origin of the sternohyoid and sternohyoid muscle. Sternothyroid and sternohyoid muscles. Origin of the and remains of the thymus gland are also the content. So these are the contents of the superior mediastinum. Okay. What is the clinical importance? Mostly the clinical importance doesn't come. Compression of the venous congestion often occurs. Arterial congestion ischemia occurs. Compression of the trachea is known as the dyspnea. Compression of the esophagus is dysphagia. Okay. And next is the inferior mediastinum. Inferior mediastinum is further subdivided into three: anterior, medial, and posterior. So first we know the anterior mediastinum. It is the narrow space in front of the pericardium, overlapped by the anterior border of the lungs. Okay, here comes the, this one is the anterior, this one is the anterior mediastinum, this one is the middle mediastinum. What is pericardium? And this is the posterior mediastinum. Okay, now we will know the anterior mediastinum. Boundary anteriorly body of the sternum and posteriorly pericardium. From the diagram you can see posteriorly the pericardium is there, anteriorly the sternum obviously, and you can also say the view of the sternum, and superiorly the imaginary plane separating the superior mediastinum from the inferior mediastinum superiorly. Okay, but inferiorly the superior surface of the diaphragm. Superior surface of the diaphragm lies inferiorly on each side with the mediastinal fluid. In everyone mediastinal fluid. Okay, what are the contents of it? The remainder of the thymus gland, loose areolar tissue, upper and lower pericardial ligament, and third one is the 2 to 3 lymph nodes and lymph vessels, and small mediastinal branch of the internal thoracic artery. These are the contents. Next comes the medial mediastinum. It is important. It is the broadest part of the mediastinum. You can see from the here, and it occupies the pericardium and its content. What are the contents? Mainly the heart. The most important content of the medial mediastinum is the heart, which is enclosed by the pericardium. And next one is the arteries. Is the ascending aorta, pulmonary trunk, and two pulmonary arteries are the arterial content of the medial mediastinum. Venous content are the lower one third. In the superior mediastinum was the upper two third, upper half of the SPC, and here is the lower half of the SPC. Okay, here the lower half of the SPC and terminal part of the axial vein, upper part of the IVC, and right and left pulmonary veins. What are the nerves? The both phrenic nerves, the deep cardiac plexus, the tubes, the bifurcation of trachea, right and left principal bronchi, lymph nodes of the tracheobronchal lymph nodes. Okay. Last one is the posterior mediastinum. Posterior mediastinum, the boundaries at the anteriorly is the pericardium. Obviously, you can see posterior mediastinum. Anteriorly is the pericardium. This is the posterior mediastinum. It is the pericardium anteriorly. Posteriorly will be the vertebra. Okay. Posteriorly will be the part of the upper. Posteriorly the lower 8 thoracic vertebra. Anteriorly, not only pericardium, there is posterior part of the upper surface of the diaphragm. On each side is the mediastinal pleura. Okay. Here superiorly and inferiorly are not given. Superiorly will be that imaginary line here. Okay. Superiorly will be that imaginary line here. Okay. And inferiorly will be the diaphragm. And on each side again the mediastinal pleura on each side of the every mediastinum. Okay. Now comes the content of the posterior mediastinum. The main contents of is the esophagus. The main contents is the tube, which is the esophagus. And the next one is the arteries, descending thoracic aorta and its branches. Vein on azygos vein, it is the most important vein. Often comes short notes and hemiazygos vein. Nerves are the vagus nerve forming the esophageal plexus and around the esophagus, both sympathetic chain and their splanchnic nerve. These are the most important content of the posterior mediastinum. Okay. In exam, the whole mediastinum may come. Okay, and the often whole mediastinum come, but regularly you can say the division of the mediastinum, which is superior and inferior division, not the inferior division. Only it comes the superior division or anterior division, anterior part, anterior mediastinum, middle mediastinum, or posterior mediastinum comes in the exam. Okay, so this important topics comes to an end here. Okay, thank you.